1. Avian flu costs dairy industry over $737,000. Study reveals heavy financial toll. 2. The shocking link: calves and the spread of H5N1 bird flu in cows. 3. The impact of highly pathogenic avian influenza H5N1 on dairy cows, risks, effects and economic losses. 1. Avian flu costs dairy industry over $737,000. Study reveals heavy financial toll. Imagine the shock when a single outbreak of avian flu led to a staggering financial hit of $737,500 for just one dairy farm. This isn't just a number, it represents the tangible impact of the highly pathogenic avian influenza, HPAI, H5N1 strain on the dairy industry. A recent study published in Nature Communications delves into the economic and health consequences of this outbreak, providing a sobering look at what can happen when a virus jumps from birds to mammals. Researchers from Cornell University conducted an in-depth analysis of a dairy farm in Ohio that experienced an HPAI outbreak in the spring of 2024. The outbreak began after the transfer of 42 seemingly healthy lactating cows from a farm in Texas. The study, which covered a period from March 8 to June 7, examined both individual and herd-level data to assess the full scope of the impact. The current HPAI outbreak in the United States has been ongoing since 2022, resulting in the deaths of nearly 175 million birds. What's particularly alarming is the virus's ability to spill over into mammals, including dairy cattle. As of the latest reports, 1,074 herds across 17 states have been infected, highlighting the widespread nature of the problem. But here's where it gets controversial. The study found that infected cows were 6 times more likely to die and more than 3 times more likely to be culled from the herd compared to uninfected cows. When the outbreak struck the Ohio farm, 3,433 out of 3,876 cows, 88.6%, were lactating. Out of the 777 cows diagnosed with the flu, 776 were lactating, and only 1 was in the dry period. Most of the affected cows were in the mid to late stages of lactation and had given birth more than once. The symptoms of the infected cows included severe mastitis, inflammation of the udder, a significant drop in milk production, loss of appetite, lethargy, and reduced rumination time. These sick animals were isolated in a hospital pen adjacent to the area for healthy non-lactating cows. On average, the acute illness lasted 7.9 days, and the cows remained in the hospital pen for about 5.1 days. The mortality rate among the infected cows was alarmingly high. Out of the 777 sick cows, 53, 6.8%, died or were euthanized within an average of 13.6 days after diagnosis. Another 245, 31.6%, were culled from the herd within 20.6 days. The overall seroprevalence, the presence of avian flu antibodies in the blood, in the herd was 89.4%, with 76.1% of seropositive cows being infected. Key risk factors for infection included being between 100 to 200 days into milk production and having given birth more than once. The economic toll of the outbreak was substantial. The decrease in milk production, which amounted to about 900 kilograms, 1,984 pounds, per cow over 60 days, combined with the loss of cows, resulted in a loss of $950 per cow. For the entire herd, this translated to a total financial loss of $737,500. This figure doesn't even account for the ongoing issues related to altered herd dynamics and potential reproductive losses. And this is the part most people miss. The study underscores the critical need for enhanced biosecurity measures and the development of effective vaccines. While the immediate financial impact is clear, the long-term consequences for the dairy industry, including potential genetic losses and the psychological toll on farmers, cannot be overlooked. What do you think? Should the focus be on improving biosecurity protocols, developing vaccines, or a combination of both? Share your thoughts in the comments below. 2. The shocking link: calves and the spread of H5N1 bird flu in cows. Imagine a scenario where calves, innocent and seemingly harmless, become unwitting carriers of a deadly virus that wreaks havoc on dairy farms across the United States. This is no exaggeration. A recent study has uncovered a shocking truth about the H5N1 bird flu virus, revealing its ability to spread through infected milk and cause chaos among cattle. But here's where it gets controversial. The study suggests that the virus might be spreading through a surprising and previously unrecognized route: calves nursing from infected cows. In a nutshell, the research, led by Professor Hualan Chen from the Harbin Veterinary Research Institute, has discovered that calves can transmit the H5N1 bird flu virus to dairy cows through nursing, specifically affecting the cow's mammary glands. The virus, known for its respiratory impact, has now been found to invade the mammary glands, leading to severe consequences for both the animals and the dairy industry. The impact of this outbreak has been staggering. Over 1,070 dairy farms in 17 U.S. states have reported cases of H5N1, with a mortality rate of up to 10% among infected cattle. The human toll is also significant, with 41 dairy farm workers contracting the virus. The contamination of milk, a staple in many households, adds another layer of concern. In fact, 25% of U.S. retail milk samples tested positive for H5N1 genes, raising alarms about the potential risks to public health. And this is the part most people miss. The study involved 50 cattle housed in a high-security facility, where researchers meticulously examined the virus's replication and spread. They found that the virus only replicates in the mouth and respiratory tract when it enters through the nose. However, when introduced directly into the mammary gland, the virus remains contained. This led to the hypothesis that mouth-to-teat transmission, facilitated by calves nursing from infected cows, is the primary route of infection. Lactating cows, especially those known for stealing milk through self-nursing or mutual nursing behaviors, are particularly vulnerable. The bovine oral tissues, rich in sialic acid receptors, are highly susceptible to viral infection from contaminated feed and water. This allows the virus to replicate and spread efficiently. The researchers confirmed that calves with H5N1 in their mouths can indeed transmit the virus to the mammary glands of the cows they nurse from. With this mystery solved, the focus shifts to potential solutions. Could vaccines, which have been successful in controlling avian influenza in poultry, offer the same protection for cattle? Initial tests of two vaccines, an H5 inactivated vaccine and a hemagglutinin-based DNA vaccine, have shown promising results. Both vaccines provided complete protection against H5N1, even under high-dose viral challenges. The successful demonstration of vaccine efficacy provides a critical strategy for protecting dairy herds and safeguarding public health. Implementing vaccination programs could be a viable solution for controlling H5N1 outbreaks in cattle. This approach not only shields cattle from infection, but also helps maintain the integrity of the milk supply chain. Additionally, the research emphasizes the importance of monitoring and managing cattle interactions, particularly focusing on calves and their nursing behaviors. By understanding the specific transmission routes, farmers and veterinarians can implement targeted measures to disrupt the spread of the virus. The study also highlights the need for global collaboration, as the lessons learned could inform strategies in other countries facing similar threats. The findings of this study, published in the journal National Science Review, have significant implications for global health and the dairy industry. As H5N1 continues to spread, it is imperative to adopt comprehensive strategies that incorporate vaccination, surveillance, and biosecurity measures. The research conducted by Professor Chen and her team offers a roadmap for managing the disease not only in the United States, but also in other countries at risk. As we navigate the complexities of H5N1 and its impact on cattle, the need for further research and collaboration becomes evident. How can the global community come together to effectively combat this threat? And what additional measures can be implemented to ensure the safety of both animals and humans? Share your thoughts in the comments below. 3. The impact of highly pathogenic avian influenza H5N1 on dairy cows, risks, effects and economic losses. The consequences of H5N1 avian influenza virus infection on dairy cows. Introduction. The highly pathogenic avian influenza, HPAI, H5N1 virus, has been a persistent threat in wild bird populations globally since 1996. This virus is notorious for causing severe illness and high mortality rates in domestic poultry. A significant outbreak occurred in the United States in 2014, when the HPAI H5N2 strain was introduced by migratory birds, leading to the culling of over 41 million birds and incurring economic losses exceeding $1.1 billion due to direct deaths, market disruptions, and international trade restrictions. Fast forward to February 2022, the HPAI H5N1 clade 2.3.4.4b virus made its way into domestic poultry in the US, triggering an unprecedented outbreak that has persisted for over 3 years. As of July 9, 2025, this outbreak has resulted in the death or culling of more than 174.8 million birds, marking it as the most economically devastating animal disease outbreak in U.S. history. The current strain of HPAI H5N1 clade 2.3.4.4b has also affected over 28 mammal species. In March 2024, this virus was identified in lactating dairy cows across several farms in Texas, and it has since spread to multiple states. By July 9, 2025, there were 1,074 confirmed herds across 17 states affected by this strain. The clinical signs of HPAI H5N1 infection in lactating dairy cows include reduced feed intake and rumination, alongside a significant drop in milk production, with the milk often appearing abnormal, resembling colostrum or matitic milk. Affected cows may also exhibit fever and mild respiratory symptoms, such as clear nasal discharge, and some farms have reported increased mortality rates among infected animals. The most critical pathophysiological effect of HPAI H5N1 infection in dairy cows is linked to the virus's affinity for and replication within the milk-secreting epithelial cells of the mammary gland, leading to severe mastitis and the degeneration and necrosis of these cells. Notably, the impact of HPAI H5N1 on milk production seems to extend beyond the clinical phase of the disease. In this study, we examined the effects of an HPAI H5N1 outbreak on a dairy herd consisting of approximately 3,876 adult cows. We explored the risk factors associated with clinical disease and the repercussions of infection on the herd's production parameters. Furthermore, we estimated the economic impact of the HPAI H5N1 outbreak based on observed milk losses, mortality rates, and premature herd removals. Results. Clinicoepidemiological characteristics and outcomes of influenza infection in the dairy herd. To evaluate the impact of HPAI on dairy cows, we analyzed production and clinical data from a freestall dairy farm in Ohio, which housed 3,876 cows and experienced an HPAI H5N1 outbreak in the spring of 2024 after transporting 42 seemingly healthy lactating cows from Texas. A summary of the herd demographics and production parameters for both clinical and non-clinical animals is provided in the accompanying tables. We collected individual animal and herd level data over a 91-day period, from March 8 to June 7, 2024, which included both pre- and post-outbreak data. This data was sourced from the DairyComp 305 herd management software and the Afamilk monitoring system. The first clinical case of influenza in this herd was identified on March 21, 2024, with laboratory confirmation of the H5N1 virus occurring shortly thereafter. At the outbreak's onset, the herd comprised 3,876 cows, of which 3,433 were lactating and 443 were non-lactating. Farm personnel, under the guidance of an on-site veterinarian, diagnosed 777 of the cows, 20%, with clinical influenza based on production metrics, and clinical signs recorded through the Afamilk monitoring system. Following diagnosis, sick animals were segregated into a hospital pen adjacent to the pens housing healthy non-lactating cows. Among the 777 diagnosed cows, 776 were lactating, and 1 was in the dry period, with most affected cows being in mid to late lactation stages. Cows were diagnosed with clinical influenza between March 21 and April 13, 2024, with the highest incidence occurring on March 31, 2024, when 121 new cases were reported. The average duration of the clinical phase was approximately 7.9 days, with cows remaining in the hospital pen for an average of 5.1 days. Alarmingly, 53 of the 777 clinical influenza cows, 6.8%, either died or were euthanized within 13.6 days of diagnosis, while 245 affected cows, 31.6%, were culled within 20.6 days of diagnosis. ########## risk factors associated with clinical influenza and its impact on cow mortality and herd removal. To identify potential risk factors for clinical influenza, we examined various parameters, including days in milk, DIM, parity, breed, baseline milk production, and somatic cell count, SCC. Our findings revealed that both DIM and parity were significantly associated with an increased risk of clinical influenza. Cows between 100 and 200 DIM had a higher likelihood of presenting clinical influenza, as did those with more than 200 DIM, compared to cows with fewer than 100 DIM. Additionally, multiparous cows exhibited a greater risk of clinical influenza compared to first lactation cows. However, breed, baseline milk production, and SCC did not show a significant association with the risk of developing clinical influenza. We also assessed the impact of clinical influenza on mortality and herd removal rates. Notably, cows diagnosed with clinical disease had a significantly higher risk of death and were more likely to be removed from the herd compared to non-clinical cows. ####### impact of influenza on rumination and milk production. We evaluated how clinical influenza affected rumination and daily milk production in the affected herd. During the preclinical period, cows that later became clinically affected had higher rumination times compared to those that remained unaffected. However, a marked decrease in rumination time was observed in clinically affected cows, reaching its lowest point approximately 12 days after the first clinical case was diagnosed. Although rumination time increased in the last 10 days of the clinical outbreak, it remained lower than that of non-clinical cows for at least another 30 days. Our analysis indicated that prior to the first influenza diagnosis, clinically affected cows produced slightly more milk than their unaffected counterparts. However, following the diagnosis and throughout the outbreak, affected cows experienced a significant reduction in milk production, which became evident just 5 days after the first clinical case, and reached its lowest point 15 days later. This reduction persisted for at least 77 days post-clinical phase, demonstrating a long-lasting impact of H5N1 infection on the productivity of affected dairy cows. ###### decrease in rumination and milk production precedes clinical disease. To understand how early the clinical signs manifest in affected animals, we estimated the daily means for rumination and milk production. Our findings revealed that rumination time began to decline approximately 7 days before clinical diagnosis, returning to pre-outbreak levels within 14 days. This pattern was consistent across cows confirmed to be HPAI H5N1 positive. Serosurveillance indicates high rate of subclinical HPAI H5N1 virus infection in dairy cattle. To assess the seroprevalence of HPAI H5N1 in the herd, we conducted serological tests on 637 cows present during the outbreak. The results indicated a